Okay, hello everyone. Welcome to BVDU Quizzing Society. My name is Shruti Rakshaye and I'm the third year clinical head for this society. So today I'll be taking a review over the varicose veins. So welcome to Anatomy Snippets. This is snippet number 7. So first I'll take a review over the venous drainage of the lower limb. So venous drainage of the lower limb is classified into superficial veins, deep veins, and perforators. So the perforators, they connect the superficial veins with the deep veins. Now the superficial veins are in the subcutaneous tissue and they are interconnected and ultimately they drain into the deep veins. The superficial veins form two major channels. So these include the great saphenous vein and the small saphenous vein. So both the veins originate from the dorsal venous arch in the foot, and 80% of the blood from the superficial veins they drain into the deep veins. Now coming on to the deep veins they generally follow the arteries. So they follow the femoral artery, superior gluteal, inferior gluteal, and the obturator. Now the main deep vein that drains the lower limb is the femoral vein. Other deep veins include the anterior tibial, posterior tibial, and popliteal and femoral veins. Now moving on to the perforators. So the perforators are basically veins which connect the superficial and the deep veins. So the perforators basically include Hunterian perforator, which is present in the thigh, the Dodd perforator, which is present in the distal thigh, and the Boyd's, which is around the knee, and you have Cockett's perforator, which arises from the posterior arch vein. So now in this diagram you can see the posterior perineal and anterior tibial veins. They drain into the soleus vein, which further drains into the popliteal vein. The popliteal drains into the femoral vein, and the femoral vein finally drains into the SFJ junction. So now also you can see the perforators also in the first diagram. So they are posterior tibial perforators, they are paratibial perforators, and perforators of the femoral canal. Now moving on to factors helping in venous return. So factors helping in venous return include negative intrathoracic pressure, arterial pressure, and overflow from the capillary bed, and also compression of veins, because as we know, the deep veins they run along with the arteries. So the pulsations from the arteries also create a pressure on the veins. Then presence of valves help to maintain a unidirectional flow, and all the veins they do have valves to prevent backflow. So coming to our topic, that is varicose veins. So varicose veins are basically tortuous, elongated, dilated veins, and you can use a mnemonic called TED. So tortuous, elongated, and dilated. And the main cause for varicose veins is due to incompetent valves. So so coming to causes, so like the main causes include, like, there can be genetic factors, long periods of standing or long periods of sitting. In pregnancy, this is aggravated. It can also be seen in obese patients and also in aged individuals. Now, symptoms include bulging. So you see bulging veins and it's associated with throbbing pain. There can be sores, itchiness, and also swelling. Now, for varicose veins, the diagnosis can be done using USG or venogram, and treatment mainly includes lifestyle changes, and compression stockings can be used. So usually compression stockings, there are different grades up to 4, grade 1 to 4. So we usually use grade 3 stockings, which create a pressure of 25 to 35 mm of Hg. Then how to manage can be do not stand for long periods, change your occupation if there are long standing hours, and also use compression stockings. So moving on to now, the basically what happens in it is, so it's as I told you, the main cause is incompetency of valves. So if the valves in the perforating veins become defective, so that leads to pressure leaks, like when the vessel contracts. So the high pressure of deep veins is transmitted to the superficial veins as they're connected to the perforators. So because of that, the superficial veins, because all the blood reaches there, so they become dilated and tortuous. So, for example, if the saphenofemoral valve becomes incompetent, then the great saphenous vein will become dilated and tortuous. Now, there are many tests that can be done to test for this. So, there's Trendelenburg test, there's Perthes, there's modified Perthes test, There's also Schwartz test. So the usually Trendelenburg test is used. So in this, this is done to assess the competence of SFJ. In this, you ask the patient to lie flat. You elevate the leg and gently empty the veins. Uh, Palpate the saphenofemoral junction, and then you ask the patient to stand while maintaining pressure over that junction. Now, rapid filling, if after the thumb is released, that means the SFJ is incompetent. And if it fills from below upwards, that means without you releasing the pressure over that junction, that means there's incompetency of the perforators. So this was an overview of the varicose veins. Thank you.